So will be the first group to present about the case right out. I'm going to be the doctor and Zoka will be the patient. So let me start.
Yeah.
Um, hi, Assalamualaikum. I'm Dr. Aiman. So I'm going to.
Waalaikumsalam.
Yeah. So how are you today?
Alhamdulillah, I'm fine.
All right. So I would like to confirm that um, your son's name and his age.
Okay. My son's name is H.I. He is 7 years old.
Okay, good. Thank you. So what bring your son here?
Uh, he got a fever for 3 days, and when I look at the body, there are rashes, and the rashes has been for 2 days.
I see.
Uh,
So how long that you notice that your son got a fever?
the fever started 3 days prior to the admission. Yeah.
Oh, so do you notice any medical problem before the fever?
Before the fever, my son was well, healthy, just
Oh,
like the other active child.
I
Yeah.
see. So can you describe how was the pattern of that fever? Is it um, is it continuous, on and
Okay.
off?
For 3 days, for the past 3 days, it was continuous, but I didn't check for the temperature because I don't have the thermometer. And it associated with shivering, and my
Oh,
child become lethargy.
I see.
Uh,
So you didn't take any temperature, aren't you? So
I don't.
and then when do you start notice that your son got rashes on? And
Oh, the rash.
is it
Oh,
happen
okay.
after fever or simultaneously with the fever?
No, the rashes started a day after the fever, so it's been 2 days. For the rashes,
Oh,
and it is associated with the rashes was itchy.
oh, itchy. Mm-hmm.
Yeah.
So,
Uh,
but that you notice the rashes appear in your son's body.
at first, I noticed the rashes started at the moment of my child, and then it spread to the extremities, to the hands, to the legs, to the upper neck, and also the cheeks of my child.
Oh, can you describe to me the characteristic of the rashes that you can see?
The rashes were red,
Mm-hmm.
uh, it were flat, and there's no vesicles, and it is itchy. Yeah.
Mm-hmm. So, did your son HI notice any or experience in pain in throat or having sore throat, difficulty of
Oh
swallowing
yes,
maybe? Mm-hmm.
yeah. My child having sore throat. Uh, the same as the fever, on the fever. So it's been 3 days duration of the sore throat, but nothing to relieve. And my son become uh, difficulty and pain swallowing due to the sore throat.
So is he having a low in appetite, decrease in food intake?
Yes,
Oh, okay.
yes.
All right. Did you notice any changes in his mouth?
His mouth. Uh, this white plaque on his tongue, but I thought it might be due to dehydration only.
I see.
Uh,
So there's no, you cannot see any redness in the mouth.
the pharynx become red and swelling
Okay.
because
So,
of the sore throat, I think.
okay. Did he vomit for the past 3 days?
There's one episode of vomiting,
Oh, so,
but the vomit is
uh,
usually fluid.
oh, so the content is fluid. Mm.
Yes.
Is he feel any pain at the joint? Complain to you there's pain in joint?
No,
Mm-hmm. Oh,
there's no joint
is there
pain.
any bleeding in the gum area or mucosal area like mouth?
No,
All right.
there's no bleed.
So can you see any notice any redness or conjunctivitis on his eye, like redness?
Oh, no, no.
Oh,
No.
any swollen in the leg or arm?
Uh, the leg and the arm was normal.
Okay. So there's no so is
No,
there any
that's really.
other part that you can see swelling, for example, the neck area or in the armpit?
I think there's no sweat at the part of my son.
All right. So for
Mm.
the past 3 days, do you
Yeah.
notice any to your son any lightheadedness, or he complained to you any blurry in vision?
No.
All right.
Okay.
So is there any significant loss of weight or appetite?
Um, Not loss of weight, but he's having loss of appetite because of it.
Reducing appetite. All right.
Yeah.
So is there any associated with diarrhea frequency
No.
going to the toilet? Oh, okay.
Mm.
So
Yeah.
any complaint about painful during urination?
No.
All right,
Urination, defecation was all normal.
all right. So I would like to know more about just brief on is there any difficulty in breathing, maybe shortness of breath?
Uh, I think it's okay.
Oh,
I think it's okay.
so no. There's is there any bluish discoloration you can see in the?
The skin was normal.
All right.
Yeah.
So did he notice or complain to? Is there any peeling around the groin area or penis?
The uh no, I think
Oh, okay.
no.
So when you notice that your son got fever and rashes, what do you give any medication to your son?
Yeah, I gave a syrup paracetamol, but then the fever does not subside.
Mhm. So
Mm.
um, do you is there any past medical problem to your son?
Uh, there is no okay. This is his first hospitalization, but
Uh,
after he has a history of neonatal jaundice, but does not require any hospitalization.
all right. So
Yeah.
is there any medical problem or complication during pregnancy or during delivery or maybe after delivery of HI?
Uh, before delivery was all normal. Delivery also okay, normal.
All right.
Uh, After delivery, he just got neonatal jaundice. That's
Mhm.
all.
So I would like to know how was his performance at school? Is it
Oh,
is it the same as other
uh,
children?
yes, he's good.
All right. So in your family, is there any history of medical illness? Maybe the same symptom?
No.
No. So before he got the fever and rashes,
Uh,
do you go anywhere like a crowded area or picnic maybe?
uh, uh, no, no.
All right. So um, I have a question that might be personal, but I would like to know, is there
Okay.
any family members that smoking in your home?
Uh, my husband is a smoker, active smoker, but usually he's at the outside of the house.
All right, thank you.
Yeah.
So before we end the session, I just want to briefly summarize on what we have been discussed. So your son HI is 7 years old, was presented to HTAA with 3 days of fever, which associated with shivering and lethargy, and 2 days of rashes, starting on the second day of the illness that um, appears at the trunk, and then he also got a sore throat and vomiting. And then there's a redness on your in your son's mouth. So,
Yes.
do you have anything to ask, maybe regarding your
I
son's symptom?
I forgot to mention that I live in a dengue prone area.
Oh, okay. Where is it?
Yeah. I live in Batu 12 Kuantan.
What what do you expect to your son uh, for because he is warded, is it? So, what's your expectation?
Mm, First, I thought it might be due to, lah, maybe due to dengue or
All right,
maybe other diseases lah.
all right. Thank you.
You're welcome.
Thank you for your cooperation. And think I would like to proceed with the physical examination.
Okay, can
Okay.
you do summary of your meeting with the patient? Ayman?
Yes. Do you want me to repeat?
Not to repeat. I
Ah,
need summary. I mean 1 or 2 sentences which give us the final conclusion of you.
okay. So HI, a 7 years old Malay boy, was presented to emergency department of HTAA with 3 days of fever, which associated with shivering and lethargic, and 2 days of rashes, which starting on the trunk, and it is appear as sand-like rashes over the body, but non-vesicular and not tender. And also there is a strawberry tongue appearance, and in fact, injected tonsil was seen.
Okay, so
Yeah, that's all.
what's your differential diagnosis then, Ayman?
So the differential diagnosis, the first one is dengue fever.
Did you ask about dengue?
Yes, I've asked about the history where HI has been before, and the pattern of fever and the rashes appearance.
Did you ask about fogging?
Uh, no, but the mothers said that they live in dengue prone area.
Okay. Okay, so can your main diagnosis now or the primary diagnosis, is it dengue?
So my provisional
Yes.
I'm sorry, my provisional diagnosis is scarlet fever,
Okay.
secondary
So
to pharyngitis.
scarlet fever.
Yeah.
Okay. Your differential?
my differential diagnosis first is dengue fever, because the patient got high grade fever and shivering, and also there is a maculopapular rashes, and also vomiting, which is one for the past 3 days, and he also live in the dengue prone area. But the patient got no myalgia, arthralgia, and there's no hepatosplenomegaly, and there also no hematological manifestation like bleeding gum. And my second differential diagnosis is Kawasaki disease, because the patient got non-vesicular rashes with the strawberry tongue, and also injected pharynx and tonsil. But the patient had, but Kawasaki disease is less common in less than 5 years old. But this patient is 7 years old, and also Kawasaki disease is less likely because the fever for Kawasaki disease has to be at least 5 days, and there are no bilateral non-purulent conjunctivitis, no edema, and no diarrhea. And then the third one is toxic shock syndrome, because the patient got rashes, maculopapular rashes, and they also complain of sore throat, and there's a strawberry tongue appearance, but the patient got no flu-like symptoms, headache, there's no headache, myalgia, and there's no symptom of hypotension. And then the fourth one is infectious mononucleosis, because the patient has fever with injected tonsil and pharynx, and there is also a skin rash. But um, it is less likely because there's no rapid breathing, no generalized lymphadenopathy, which is will be the characteristic of infectious mononucleosis, and also there is no hepatosplenomegaly. And the last one is rubella, because the patient has maculopapular rash, also with sore throat. But in rubella, normally the patient will present with low-grade fever, but in these cases there is no the fever is high, and no conjunctivitis, no headache, and no lymphadenopathy. So that's are the five differential diagnoses for scarlet fever in this case.
Why rubella and not measles?
Mm, yeah, I think measles got the same.
Yeah, rubella is considered like a mild measles. Measles will be more frank and rashes and like that. Okay, so if we come back to the your professional diagnosis, which is post-streptococcal scarlet fever, yes.
Yeah.
What investigation you are going to consider?
So for the investigation, um, first we can diagnose by the criteria or by MAC-SAC, which is the modified criteria of center. We look for the history of the temperature, which is more than 38 degrees Celsius, absence of cough, tender of the anterior cervical adenopathy. The next criteria is tonsillar exudate, and age, which is important, 3 to 14 years old. So any if more than four of this point is associated with positive laboratory for group A streptococcal for the scarlet fever. But this test is this criteria is 70% positive for the laboratory test. So I will proceed with a laboratory testing for accurate diagnosis. So I would like to do a confirmation diagnosis, which is uh, throat swab and nasal culture to isolate the causing pathogen, and then serologic tests, for example, anti-streptolysin O titer, and we can do a rapid streptococcal test. But the first thing that I will do is look for to get the full blood count, to look for leukocytosis, which is you can see that the patient is got infection, and then there's inflammatory marker, and I will do renal profile and liver function test to look for any abnormality and to rule out other causes. So that's all for the diagnosis for scarlet fever.
What other causes which can cause fever and rash and the abnormal liver function test?
What are the causes that can cause liver?
Is it dengue fever?
Yes, dengue can. What is the next one? One of the common also communicable disease here in Malaysia.
Is it infectious mononucleosis?
No.
Um,
Usually the patient will be presented by transaminitis, and he may can get some conjunctivitis, some cough pain.
Is it rubiola, doctor?
No, leptospirosis.
Oh.
Don't forget leptospirosis because it is very important. You must ask about is there any exposure to rats, because ticus can transmit it, any recreational activity. I know that most of the people now are quarantined, but you must ask about that. Also, the most important, is there any conjunctivitis or not? Okay, so there is an important list for leptospirosis. Okay, I would like just to let you finish your presentation and give you a comment at the end. Okay.
all right. For the next discussion, I'll pass to Zulwakar to further explain about the scarlet fever.
Assalamualaikum warahmatullahi wabarakatuh. I will explain a bit detail about the scarlet fever, our case for today. Okay, first, what is scarlet fever? Scarlet fever, an overview, it refers to diffuse erythematosion, or we know as, that generally occur in association with sedative pharyngitis and fever. So, in simple words, there are three clinical present in scarlet fever. First, fever. Second, exudative pharyngitis. And the most important is rashes. And it is commonly occur in age 5 to 15 years old. The etiology of the scarlet fever is grade beta hemolytic streptococcus, or the most common isolated microorganism is Streptococcus pyogenes. How does Streptococcus pyogenes cause scarlet fever? Because Streptococcus pyogenes, they produce pyrogenic exotoxin, or known as Streptococci pyrogenic exotoxin. And this exotoxin is believed to be the one that is responsible to the rashes development. And this exotoxin also will overstimulate T cells, which produce high levels of inflammatory cells and also cytokines and immune response. And this response or inflammatory response, it will cause dilatation of the blood vessels, and there will be development of the rashes due to the dilatation of the blood vessels. Okay, the clinical presentation for scarlet fever, the incubation period is 2 to 5 days. So between 2 to 5 days, the child doesn't present with any sign and symptom. But after that, the patient will present with fever and sore throat. The high grade fever that associated with chill, sometimes headache, abdominal pain, and vomiting. And then when we look at the pharynx is injected or red, and the tonsil is enlarged. And when we look skin of the child, there will be rashes presentation, and these rashes usually presented after 1 to 2 days of the onset of the symptoms. How can we describe rashes? Look at the picture. The rashes usually it is diffuse. Oh, sorry. It's diffuse, and there's fine purpular erythematous eruption, bright discoloration. It appear at the neck, at the trunk, at the extremities, at the hand. Okay, that's all about the rashes. And the second one is the tongue. When we look at the tongue, there might be strawberry appearance or swollen papillae. Look at the picture here. This is known as strawberry tongue. And this one is the whitish plaque or whitish tongue that over the tongue. Okay, this is the picture. Okay, the complication of scarlet fever, it can be divided to suppurative or non-suppurative. But we look at the non-suppurative first. This is the most common complication that we need to aware of in scarlet fever. The first one is acute fever. Second is post-streptococcal reactive arthritis. And the third one is acute glomerulonephritis. And all of these are immune associated. So which means the antibodies in the child, it against self-antigens, which will lead to clinical presentation. And other complication is suppurative. It can be either peritonsillar or pharyngeal abscess, otitis media, sinusitis, meningitis or brain abscess, rising fasciitis, streptococcal bacteremia, bronchopneumonia, streptococcal toxic shock syndrome, and osteomyelitis. So these are among the complications of the scarlet fever. So how to evaluate and diagnosis of scarlet fever has been explained by Aiman now. But brief repetition for children, we use mixed-lag which history of temperature more than 38 degrees Celsius with absence of coughing. And then there is cervical lymphadenopathy, and there's tonsillar swelling and exudations, and most common at the age of 3 to 14 years old. And if the max-lag score is more than 4 and associated with positive laboratory tests for group A streptococcus in more than 70% of children with pharyngitis. So we need to do tests. So this is the lab test, had already explained by Aiman before. We use throat and nasal culture and serologic tests such as antistreptolysin or titer. So for management, because this is bacterial infection, so we need to give antibiotic. And the first line drug for treatment of scarlet fever against streptococcus is penicillin and amoxicillin as a first line drug. And if it's allergic to penicillin, we can give first generation cephalosporin. And the course of treatment can be take about 10 to 40 days. And we should notice clinical improvement after 24 to 48 hours of antibiotic initiation. So that's all discussion regarding the scarlet fever. Next, we move to the some of the questions related with the scarlet fever. So I hope everyone can participate answering the questions. Okay, the first question. A 6-year-old boy presented with fever, and it is associated with strawberry tongue. On examination, there is rough skin at the elbow. State the likely diagnosis. Who want to answer this question? Allah.
Scarlet Fever.
Okay, it might be diffuse fever because there's strawberry tongue was on of the presentation and rough skin. Again, causative organism in scarlet fever.
Group A, beta hemolytic streptococcus.
Yes, group A, beta hemolytic streptococcus. And state 3 differential diagnosis of scarlet fever.
I want to answer.
Okay, Fadil.
Is that Kawasaki disease?
Okay.
Allergy?
Okay.
Okay, just two.
It's okay. So it can be either. Okay, the first answer is scarlet fever due to group A beta hemolytic streptococcus, and the 3 differential diagnosis causes skin disease, toxic shock syndrome, and also allergy that can present fever, strawberry tongue. Okay, next question. 10-year-old Malay boy present high-grade fever for 2 days duration associated with sore throat. On examination, the tonsil is inflamed and exudated. There are rashes over the trunk and limbs. So state the possible diagnosis. Anyone?
Scarlet Fever.
Okay, it can be either scarlet. Okay, what other investigation you would like to do for scarlet fever?
Full blood count to look for any abnormality in the cell count, especially white blood cell count,
Okay.
and throat and nasal culture to look for the causative organism, and and anti-streptomycin titer, because scarlet fever is most likely caused by the group A beta hemolytic streptococcus. That's all.
Okay, thank you, Akil. Question 3, state 3 complications associated with scarlet fever with this condition.
The complications can be acute rheumatic fever,
Okay.
post-streptococcal glomerulonephritis,
Okay.
and it can also be the complication can also be suppurative, such as otitis media and pharyngeal abscess.
Okay, thank you, Faiza. And these are the answers. Okay, next question. A 4-year-old Malay boy presented to emergency department of HTA with fever associated with skin rash.
Sorry, if you can come back to this tonsillitis.
Yeah.
Yes, you need to add. There is an important also way to differentiate between viral and bacterial tonsillitis. Anyone knows it? Sometimes it can be viral. Okay, so we need to put one to differentiate between viral and bacterial tonsillitis. And very important, if you found any tonsil with like a membrane, you must do 2 things. You must go ahead and ask about the vaccination, because we got now some category with anti-vaccines. And if someone doesn't get vaccine, he can get diphtheria. which is a very, very dangerous and life-threatening and can be presented by just pseudomembrane over the tonsil, which can propagate to even cause infection in many areas in the body, including the heart and like that. Okay, so you must keep in mind differential diagnosis, and if you just one photo or one picture about the diphtheria, because this case may be used for others after that. Okay.
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 Thank you, Dr. Mossad. Okay. Last question. Nick for you. I presented to EDHTA with complaint fever and skin rash. State the question you would like to ask. Anyone?
I want to answer.
Okay.
So the first question is the duration of the fever and also the rash. And then is it the fever is associated with sore throat? And if another question is there is any travel history to dengue risk area.
Okay. Thank you, Hanan. Okay, question two. Three physical examination you would like to do and state the possible findings. You want to try Akil Akram?
Yes, I will try. Usually, during general examination on inspection, the patient face may appear red or flush, and on the skin examination, usually the patient may have a maculopapular rash over the abdomen, trunk, neck, and extremities. And when we examine the mouth, the fairing may look red or injected, and the tonsil enlarged and exudate.
Okay. Thank you, Akil Akram. And then state three differential diagnosis regarding to the fever and rash. Anyone?
Can I try?
Okay, Farah.
The differential diagnosis, it can be Scarlet Fever, Kawasaki disease, and also Dengue Fever.
Okay. There are many other differential diagnosis. So it is among the answer that you gave. Okay, I think that's all from us. Thank you. Okay, that's all from us.
Now, did you finish the first case?
Yes, we finished.
Okay, so it is very important. Now we are speaking about an important presentation. The fever. Okay.
Okay.
The fever are one of the most important signs. And if we are speaking about fever, we are going to speak all about the pathological causes of the disease. It may be infection, it may be autoimmune, it may be, you know, that one, even autoimmune disease can be presented by fever, even malignancy can be presented by fever and increased metabolic rate, trauma, like that. But with time, we must be able to filter our patients. So now the patient came with fever and rash. It is very important now to consider lesser cycle. Okay, fever with rash as your colleagues speak, mainly we have a lot of communicable disease here, which can be presented by fever and rash. Dengue fever. That's why we must ask for every patient. And most of you know that with COVID, the incidence of dengue also increased a lot in many areas in Malaysia. So you must ask about dengue. We must know. I think you must know the one slide about the rash of dengue fever, and it is good if Zulwakar add like one rash of dengue fever beside the differential diagnosis, one rash of that disease, one slide, I mean, which will give us impression about that, okay? We have also leptospirosis, which can cause rash and other, okay? We have chikungunya here, which is a viral infection, looks like dengue, but with different distribution, okay, can be. We have here in Malaysia, like some area before got like typhoid fever, okay, enterica, okay, it will come with a rash in the abdomen known as rose spot. And there is another criteria, which is a pattern of fever. That's why we must ask ourselves about the pattern of fever. Even if you come, inshallah, soon to the hospital, for every patient, you can open the vital sign and see the temperature trend, which can guide you. Like in dengue fever, you know the three phases of distribution of the fever. In typhoid fever, you have like step ladder. It will 37.5, 38, 8.5, 9, like that. It will increasing. And it is accompanied by relative bradycardia. He is febrile, but the heart is not increasing. So we have a lot of differential diagnosis, which we mustn't omit. This time you will know a lot. That's why I'm advising you, you are now starting in your third year, you still have about 1,000 days to tell you, doctor, graduated and hoping to get your house officer here or there. So I'm advising you to start early from now. Now we speak together. Yes, I can accept for the first session between us to have the common, to have a soft touch. But your role with time is to be able to build up yourself. Beside transmitting knowledge from the book to the brain, I know all of this not in the book. I needed to make soft copy inside your brain, and Allah give us unlimited. The first word that came in Quran is Iqra. The first dua for Sayyidina Ibrahim, وَقُلْ رَبِّ زِدْنِي عِلْمًا. Ilm is very important for anyone, and it is more important because it is considered ibadah for Muslim. Okay, so you will find a lot of cases. Even we have here one disease known as myelinosis, which can be presented by fever, some rash, but most of the time it can be presented by small abscesses. Okay, if the patient has fever and another type of rash like vesicular rash, we may consider chickenpox. So even the type of the rash will guide you, is it maculopapular, is it vesicular, or other type. Okay, with time you will see that autoimmune disease or some chronic disease like chronic juvenile arthritis, which is known as rheumatoid arthritis of the childhood, will come also with rash, okay, known as Salmon patch, and sometimes it will come with fever. So this is the important point, to start to know what is the pattern of fever. If some patient get now for you and you find him some rash and jaundice and mild anemia and the fever, which has a special pattern, you may think about mosquito, which can bite also. She can bring dengue, but another mosquito can bring malaria. It's present in some area of Malaysia. So now we are just starting, but we need to be broad-minded, so we will not miss or lose an important diagnosis. Okay, is it clear? So if I put fever and rash, I will do. If this rash has different characteristic, I will do. If fever with rash with like another criteria for scarlet fever, so I will go for the disease. For every disease, I will go for the criteria. Even rheumatic fever, which you speak about as a complication, can be presented by fever and other skin nodules and erythema marginatum. So all these are unlimited diseases. Okay, good start, but I hope you can understand and try to build yourself every day with a new knowledge, with a new case, and try to do folder for everything you are doing. Okay, and I advised all of you, because now you have off campus for our kulliyah, for our library, you can go off campus and got everything up to date like that. Anything you need to read about, you will find the recent article in your hand. Before, it is very difficult. You must search for a book to read on it, and you must go far distance just to open for some article. Okay, so everything in your hand, please concentrate and make a good intention, okay, that you need to make benefit for your community, for yourself, for your family, for your community, for your ummah, to be a good example, to be competent doctor, but carry the Islam. Okay, don't forget this point which you spoke about. It is very wide differential diagnosis, but we are trying to do as best as we can. I would like to ask how many candidates now? 1, 2, 3, 4, 5, 6, 9. Are you? Is there anyone absent today?
No.
So you are only 9.
Yes, our group has 9.
Yes.
Group 10 or 9? 9. Okay. Okay. Is it clear? So this is an entrance to the medicine. Fever. What is the pattern of fever? Can guide me. What is the other symptom with fever? It will guide me. What is the other symptom? Okay, what is the history? What? And remember that we are diagnosing mostly by the about up to 70% by the history. And the examination, it may take to 20 to 25. And the final will be investigation. So you must ask yourself, what is the important investigation I need to do and what I'm looking for? Okay, so if someone said I need to search for streptococcal pneumonitis, so I would like to do ASOT, I would like to do anti-DNAs, which is a recent test and more specific for that one. And as your colleagues speak, we have now cause, which is the tonsil, cause rash, and scarlet fever. So I must know the root and the fruit. I mean by the disease itself, which is fever. Okay, its root here is the streptococcal infection in the tonsil. The fruit can be many complications, as we speak before, which can be rheumatic fever or other. Okay, let's go for the second presentation.
Bismillah. So I will be the second to take the history, and Farah will be the parent. Okay, so Bismillah. I will start now. Assalamualaikum, madam. My name is Nurul Hanan binti Muhammad, and I am a third year medical student. And Okay, so I would like to take history from you. Is it okay for you, madam? Okay. So first, I would like to confirm the details of the patient. So I would like to ask your child's name, age, and also child's name and age.
Okay, my child name is Kaira Humaira, and she is 3 months, 24 days old today.
Okay. What brought you and your child to the hospital?
Actually, I noticed that there is a bulging on top of her head for the past 1 day.
All right. So the bulging on the head. Is the bulging located at the front of the head?
Yes, it is on top of her head.
Okay. So is the bulging is painful or is it itchy?
I don't think it is itchy and painful, but she is irritable.
Okay, so she's irritable. So, madam, I would like to ask, if your child is, she has been unwell before.
Yes, actually, she has fever starting from 2 days ago. And then I brought her to GP. But then the GP gave me paracetamol syrup. But I haven't given that to her yet. The next day, I noticed that there is bulging on top of her head. Then I brought her here.
Oh, so did you record the temperature?
Oh yes, I recorded the temperature at home, and the temperature was 39.2 degrees. So it is actually very worrying.
Oh, so it's very high. Okay. Does the fever is associated with cough or runny nose?
Yes, she has a runny nose.
But okay. So, how about any cough or rashes?
No rashes, and no cough.
Okay. So, uh, is there any nausea or vomiting?
No.
Is the baby has a stiff neck or um when her neck is extended, does she cry?
So far, no. There is no stiffness.
Okay. So also is there any like sensitivity to light or photophobia?
Also no that.
Okay. So I would like to ask if she has any history of seizure.
No.
Okay,
No.
so
Instead of
no.
seizure.
And if she has any history of fall or trauma.
No. 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 There is no fall trauma.
Okay. Uh. Uh. For the fever, is it associated with chills or rigor?
No. No chills and no right.
Okay. So just before you mentioned that she has a runny nose. So does uh the discharge is what is the discharge like?
The discharge is quite watery. It's watery.
Okay. Okay. So I would like to ask if there is any people with that is sick around her before.
Oh yes, actually, her other siblings has common cold before for the past 2 days.
All right. And then I would like to ask, uh, there is no next sickness, right? Okay. Uh, how about is there any history of diarrhea or abdominal distension?
No, no diarrhea.
So
And
so her so her um so her stool was normal.
yes, so,
And how about her urinary frequency?
so far I think her urinary frequency is normal, just same as before.
Okay. So I would like to ask I would like to confirm, is this her first uh there is no medical illness before?
Yes, there is no medical illness before, so this is her first hospitalization.
How about her immunization?
So far, he is. I brought her to I brought her to hospital to immunize every month, and her last immunization was last month.
Right. For her during is there any complication or any diseases during your pregnancy with her?
The pregnancy was normal and uneventful, so I think there is no complication.
Okay, how about during delivery? Is there any complication?
No, also no. I delivered her uh, normally through vaginal delivery.
Okay, so what is her weight during the delivery?
Her weight during the delivery was 3 kg. It's 2.99 kg, almost 3 kg.
Okay, so after the after her birth, is there any um complication or any?
There is no complication, but during her first month, she has jaundice, but then it resolved to 4 days.
Okay, so if does she have are you breastfeeding her?
Yes, she is fully breastfed.
Okay. So there is no any feeding problem.
So far, there is no feeding problem.
Okay. So is there any drug or drug allergy?
No drug, no drug or medical allergy.
Okay, so I would like to ask about her development. If you compare with her other siblings, does her development is according to her age?
Yes, I think the development is according to her age because the development is just the same like her other sibling, her older sibling.
Okay, so I would like to ask if there is any history any known medical illnesses in your family.
Mm, medical illness.
Okay, so I would like to ask what is your husband work?
My husband worked as a soldier.
Um, how about you?
I am full-time housewife.
Okay, so how many siblings does she have? She has
She has three siblings, two older siblings.
two older siblings. How old is her older sibling?
Her older siblings is 5 and 2 years old.
Okay. I would like to ask if there is any is your husband is a smoker?
Yes, he is an active smoker. That's why.
Does he smoke in the house or outside the house?
He smoke outside the house.
Okay. So I think that's all. So I would like to continue with physical examination later.
So can you summarize, Hanan?
So for summary,
I need you from the start to be able to give all details and also to be able to summarize. With time, when you are starting your practice, you will have a lot of patients and you must be able to have both in your hands.
Right. So,
Detailed report and an important and conclusive summary also in 1 or 2 sentences. Okay.
so Kyra is a 3 months old, 3 months old, 24 days infant with no non-medical illness was presented with to the IIMC with complaint of having a bulging for at the head, top of the head for 1 day duration, and it is associated with high-grade fever and rhinorrhea for 2 days duration with irritability. She has had a history contact with sibling with cold at home. Otherwise, there is no symptom of headache, nausea, vomiting, and there is no seizures episode, and also there is no history of trauma.
So, what's your professional or your initial diagnosis?
My provisional diagnosis is meningitis because of the bulging of the head, anterior continent, and also associated with high-grade fever, and there is irritability.
Okay, what can be the cause of this meningitis?
Sorry,
What can be the cause?
of this meningitis. Meningitis can be caused by bacterial or viral infection.
Okay. Okay, so how can we diagnose that meningitis?
Usually, to diagnose meningitis is to confirm by the uh, cerebrospinal fluid analysis.
Looking for what?
Looking for the um, the at the for the cerebrospinal fluid analysis, looking at the appearance of the fluid, and also if the appearance is clear, it is most likely to be caused by viral, and if it is turbid, it's more likely to be caused of bacterial, and also we look for glucose, protein, glucose and protein, and also the presence of lymphocyte.
WBC.
The,
Either
the
neutrophil
value
or
of WBC.
so if you are going to do CSF, how many bottles we are going to send? Farah,
Sorry, Doctor, how many?
how many bottles you are going to send for CNS for CSF?
I think only one.
Now who can increase? I think we will get it during our skills, but at least 4. And the mother will now, as you a mother, you are going to ask Hanan, what is this lumbar puncture? Can you tell her, Hanan? The mother is worried because now you are going to counsel her for doing lumbar puncture.
Yes.
Do it, role player.
Oh, okay. For the lumbar puncture.
Speak to the mother again. Hi again.
Okay.
Blah blah blah. Do complete scenario.
Okay. So, Madam Farah, to confirm the diagnosis, because to confirm the diagnosis, we need to do the lumbar puncture. to your child. Is it okay?
Can you explain a little bit more detail about lumbar puncture?
Lumbar puncture, we do lumbar puncture in order to extract cerebrospinal fluid from. Okay, so we puncture the skin at the spine uh, at the at the spine, and then we took the cerebrospinal fluid,
Uh,
uh,
mm,
and then
may I know that is it safe for my daughter?
yeah, usually there is the lumbar puncture is a there is no complication for lumbar puncture. Yeah. Mm. Usually it is safe. Yeah. Um.
You came with a benign mom. So if you are going to give the patient any counseling or any bad news or like that, you must be prepared and you must start again by introducing yourself and trying to revise for here. Your child came with blah blah. Sorry to tell you, because you must touch the heart of the patient. Now Allah put you in the level of you are the caring one, not the patient. You will remember if someone is in the same scenario but the different role player, it is very difficult. So you must tell her sorry for that. I would like to you are caring for your baby, you are searching the best for him, but his presentation must be ruled out an important cause, which can be infection in the center, in the cover of the brain known as meningitis. And to do that, we must get few drops from the fluid around the brain. It is specific for this. We cannot confirm the meningitis unless we get few drops from this place where I'm from the back, from the lower back. I'm going to introduce just simple sealing, okay, to collect a few drops for this to tell us if there any infection or not. Even the blood is not enough to tell us is it infection in the brain or any other area, okay. And when she asked you safe, tell her there is possibility for infection. There is possibility, sorry, for some complication. It is not like that on the media, which we speak, it can cause paraplegia, it can cause paralysis like that. No, no, not at all. It is just a drama, but sometimes it can cause mild headache. We need to give sedation for the child. Can like that. So you must say, don't say completely safe, never. And you must tell, we used to do that for hundred and thousand babies, and hopefully it is very safe at the end, and the complications are very low. And I remember the last time the mother came with the baby like that, I tell her another important point, mom, because she is educated. Do you know if I didn't do CSF, I will write my original diagnosis is meningitis. So I am going to give your child 14 days antibiotic, even not confirmed for me, because meningitis needs longer time and the high dose. If I did the CSF and it came negative, we said Alhamdulillah, or it came viral, we are not in need to give all this course of antibiotics. So your child can discharge normally after 5 days like that maximum. No need to stay in the hospital for 2 weeks. The mother really became very appreciated. Really, doctor, yes. We need to rule out disease. So communication in medicine are very important. You are not going to be a doctor who need to catch pen and paper and write the name of the medication goodbye. No, you are a social. And even in Islam, if you are sympathize with patient, you are getting a reward from Allah. Even there is Hadith Qudsi, if you know what is Hadith Qudsi, and this is talk from Allah through the Prophet. يعني إذا من عاد مريضا, يعني if you visit marid, if you ask for marid, you will get hasana. What about if you are caring for him and give him the best care? Okay, so I just try to handle yourself for that. Yes, that's why here meningitis and the appearance of this table must be copy paste in your brain, please. Okay, it is very important one. Okay, what is the other differential diagnosis, Hanan?
The differential diagnosis is encephalitis, and then hydrocephalus, and also intracranial hemorrhage.
So all this can cause, and
Uh,
even thrombosis, okay, like thrombus also can cause in the brain, can lead for that. So it is very important. Hydrocephalus is one of the most important differential diagnosis, okay, with any increase in the intracranial pressure at the small age, at the young age before closing the fontanelle. That's why if this patient more than 1 year, you will find typical neck stiffness, Kernig's, Brudzinski signs. But for a small baby, you will not find it in the most of the cases. That's why the anterior fontanelle is a very important one. Okay. Let us continue your presentation. Can start from the first, yeah. Okay.
Okay, I'll continue the presentation. So today our discussion is about meningitis. Next. Yeah, meningitis is actually the inflammation of the meninges that covering the brain. And usually the common cause for meningitis is virus, and usually most viruses are self-limiting. Next. There are actually many causes of meningitis, which can be further classified to infective and non-infective. As for infective causes for meningitis, it can be due to infection of bacteria. For example, in units, they can be infected by group B Streptococcus, gram-negative bacilli such as E. coli, and Listeria monocytogenes. And for 1 to 3 months old infant, it can be due to strep pneumonia, gram-negative bacilli, and also group B Streptococcus. As for more than 3 months infant, it can be due to strep pneumonia and also Neisseria meningitis. Meningitis can also caused by viral infection such as enterovirus like ecovirus and Coxsackie virus. Can be also due to polio, mumps, herpes simplex virus, HIV, and also Epstein-Barr virus. Can be also infected. They can also be infected by fungi such as Cryptococcus neoformans, Candida albicans, and Histoplasma capsulatum. And meningitis can also caused by non-infective cause such as malignancy, intrathecal drug, and also blood. Next. So these are clinical features for meningitis, which is the symptoms. The patient can present with headache, nausea, and vomiting, lethargy, photophobia, whereby the patient may experience eye pain or discomfort because of when exposed to the light because of the increased sensitivity towards light, and fever. And the patients may present with purpuric rash, neck stiffness, bulging fontanelle in infants, opistotonus, which is the abnormal posture where the patient can be abnormally arched because of the muscle spasm, positive Brudzinski and chronic sign, and there is sign of shock and also focal neurologic signs. As for positive Brudzinski and chronic sign, the patient may present with for Brudzinski sign. The patient may present with when we want to do the physical examination because of the severe neck stiffness. It causes the patient's hips and knees to flex when we flex the neck. And as for chronic sign, there is severe stiffness of the hamstring, causes an inability to straighten the knee to 90 degrees at the hip. Inability to straighten the leg when the hip is flat and 90 degrees. Okay. Next. And then as for investigations, first we want to do full blood count to check for the hemoglobin, MCH and MCV to detect if is there any anemia. And also we want to check for white blood cells for infections. Is there any leukocytosis? And we want to check for ESR and CRP. Is there any signs of inflammation? And we want to do renal profile to check for hydration status and electrolyte imbalance. Also, to confirm the diagnosis, we need to do lumbar puncture test, and then we send it for biochemistry test. And we also want to do culture and sensitivity. We want to culture the cerebrospinal fluid, blood, and also urine sample to detect any organism. And because the patient presents with bulging of the head, we want to do head CT scan and brain MRI to detect is there any complications that caused by the enlarging of the head circumference, prolonged depression of consciousness, prolonged focal or lip seizures, and focal neurological abnormality, and suspected subdural effusion, or is there any empyema? Next. This is the result for lumbar puncture test. As we can see, if we take the lumbar puncture test, first we can see the appearance. If is the appearance of cerebrospinal fluid clear or turbid, it may indicate something. So as for bacterial meningitis, the appearance of the cerebrospinal fluid may be turbid, and then after we further investigate, we can detect we can check white blood cells, protein, and also glucose. As for bacterial, there is the presence of polymorph, and there is increase in protein and decrease in glucose. As for viral meningitis, the appearance may be clear, but then when we check for white blood cells, there may be presence of lymphocytes that initially may be polymorph, and then the protein may be normal or may be slightly increased, and the glucose also may be normal or decreased. And as for tuberculosis, the appearance can be a bit clear or viscous, and then there is presence of lymphocytes, and there is increased protein and decrease in glucose. And as for encephalitis, the differential diagnosis, the appearance may be clear and there is presence of lymphocytes and may be increase in protein and glucose, or it can also be normal. Next. As for the management, first we want to do the supportive management. Next. We want to do the supportive management whereby we monitor the vital signs of the patient and also her input or output for hourly. And we want to do daily CNS assessment.
Daily is very wide. Recommendation not for daily, for close or frequent CNS. Sometimes upon admission, you may need to see him every 2 to 4 hours for all assessment like that. Okay, because you picked the patient hopefully before he started to get convulsion. You picked the baby before you get another complication like loss of consciousness, like deterioration. So it is very important to take care about that. Okay.
Okay, thank you, Doctor. And then as for medical management, we can start with antibiotic treatment. And for it is the dosage is according to the age group, and also the for less than 1 month infant, we can start with giving them penicillin and cefotaxime for 21 days. And then for 1 to 3 months, also we can
ربنا
give
يديك الصحة يا رب. انت ما
okay. For 1 to 3 months, also penicillin and cefotaxime up to 10 to 21 days. And as for more than 3 months, maybe this is applicable for this patient. We can give them penicillin and cefotaxime or ceftriaxone for according to the organism. For Haemophilus influenza, it can be up to 7 to 10 days. For strep pneumonia, 10 to 14 days, and for Neisseria meningitis for 7 days. Okay, my friend will continue.
You can continue for Oski. Is it finished?
Okay, so for the OSCE questions, for question 1, this is the result of the cerebrospinal fluid of a patient. The color is turbid, the glucose is low, and there is high protein. So question 1, what is the diagnosis based on this result? Anyone can answer this question?
Is it bacterial meningitis?
Okay. So for question 2, give 2 gram-negative diplococcal organisms that can give rise to this CSF result, which is, okay. Anyone want to answer this question?
I want to try. The first organism is meningitis, and the second one is Haemophilus influenza type B.
Okay, so Neisseria meningitis and HIV. Okay, so the third question is, what are the complications of the diagnosis? The diagnosis that they give is bacterial meningitis, right? So what are the complications? Anyone can answer this question?
Okay, I want to try again. The first complication of bacterial meningitis is hearing loss. Second is vision loss. Hydrocephalus, cerebral abscess.
Okay. So next.
Either to add for this slide the white count or make it as a question. What did you suspect to find the WBC in the CSF? Because
okay.
still for the previous one, there is a bit differential diagnosis. You will know after some time that lumbar puncture is not only restricted to meningitis and encephalitis. It has many other, like if we suspect GBS, not group-based streptococci, it is Guillain-Barré syndrome. Okay, you will find some result known as protein cell dissociation. May find the protein is high, but the cell is low. Okay, so I think you can add, even you can add what did you suspect for the white count to be inside the CSF. Okay. Of course, even mortality, high mortality and the morbidity, especially if not diagnosed or late diagnosis. Okay, so even there is possibility of death due to complication, or the patient may progress to shock or the ICU. Good. Continue, Noor Hayati.
Okay, so next. So question 2. Can someone list what are the common causative organisms for meningitis in for bacterial meningitis in neonates, according to neonates to 3 months or 3 months to 6 years old and over 6 years old, and also the the common causative organism for viral meningitis in pediatrics. Can anyone answer for the neonates and to 3 months old? What are the common bacteria that cause meningitis?
For units to 3 months old, the causative organism can be group B Streptococcus and E. coli. For 3 months to 6 years old, it can be Neisseria meningitis, Streptococcus pneumoniae, and Haemophilus influenza B. While for over 6 years old, it can be Neisseria meningitis and Streptococcus pneumoniae. As for viral meningitis, the causal organism, the causal can be enterovirus and herpes simplex virus.
Okay, thank you, Faiza, for the answer. So next slide, please. So these are the answers of the question. For viral meningitis, there are a lot of viral causes. You can choose any of the virus. So next. Okay, so the third question is, this is a picture of a procedure. Question 1, what is the procedure and why is it done? And question 2, what are the contraindications to this procedure? So can anyone answer this question?
This procedure called lumbar puncture. This is to collect cerebrospinal fluid for investigation, or if we suspect any brain, yeah.
Okay, so question 2, the control. Okay, so what are the contraindications for this procedure, lumbar puncture? Can anyone answer this question?
I want to answer. For the contraindication for lumbar puncture is when the patient is hemodynamically unstable, and if there is if Glasgow Coma Scale is less than 8, if there is unequal pupils or abnormal eye reflex, and also if there is abdominal posturing or lateralized signs, and if there is or we cannot do lumbar puncture immediately after a recent seizure, and also we cannot do lumbar puncture if the patient has papilloedema.
Okay, so thank you, Hanan, and Aiman for the answer. Next slide. Okay, so this is lumbar puncture for the collection of CSF, and there are some contraindications for the lumbar puncture.
It is very important.
Okay, so next question.
No. Keep, please. It is very important. We must write under the category of increase intracerebral pressure, increase ICP. So we will come back to the basic clinical science to understand what increased intracranial pressure can cause. It can cause herniation of the brain. Okay, do you know that the cerebellum and the part can go through the foramen magnum and cause, of course, usually death and like that. So herniation of the brain are very dangerous. That's why any increase in the intracranial pressure, this is number one. And you forgot a very important simple cases, like if there is abnormal coagulopathy, I mean the platelets are very low. If I puncture, I will cause bleeding. Okay, so it is contraindicated. If there is infection in that area, it came to us before one patient who suspected meningitis, but they have severe inflamed eczema in the back. We cannot go through by the needle through infection. Why? This infection will go directly to the CSF. So if he doesn't got meningitis, I am be the one to give it to him. So local causes or systemic causes, like as I told you, increase intracranial pressure or like that. So it is very important to update this one. Okay.
Thank you, Doctor, for the information. Basically, you can read this in the pediatric protocols.
Good,
okay,
good,
so
pediatric protocol is a very precious book, but they are trying to give you the most dangerous, the most common, because I am the one who is are very fonded by that book, because it is not simply to be able to make recommendation for one branch like pediatric by in a small book. It is a very important. I like this book, and I advise most of my children to go through it, because it gives experience very wide. Okay, and it is tailored for all Malaysia, for not from the medical point only of view, even from the financial point, from the social point, for many points, which is very important. But sometimes we must, while learning, as I told you, if you are presenting meningitis, you can just press up to date meningitis in children. Like that, go for Google and just do images of meningitis. Like that, you will find, alhamdulillah, everything in your finger. Just submit. You will be very nourished by knowledge. Okay. Thanks. Okay.
okay, so there is last question.
Remember, remember that also, if Glasgow Coma Scale is less than 8, which is an important landmark. Okay, even if the patient just a while. This Glasgow Coma Scale less than 8, it may be indication even for intubation, because the patient cannot secure himself. Okay, it's very important to remember this number 8 are very important. Okay, continue, Hayati.
Okay. So for the last question, this is the CSF analysis result of a 6-year-old orang asli boy with a fever for 10 days and deteriorating schoolwork. So the color of the CSF is yellow turbid, the protein is high, the glucose is low, and the white blood cell count is high. So the questions are, what is your provisional diagnosis? And the second question is, how do we differentiate viral and bacterial meningitis? Can anyone answer this question? Anyone want to try?
Does it look the same question before? Is it the same? Looks like the one your colleague presented before or different?
It's similar but different question. Yes, it's quite similar, but it's
But try to merge both of them in your presentation. You can merge both. Okay, continue and merge both because you will make all modification which I asked you to do and just send it if new group come and they know what to do, so they find your name and got some knowledge. Okay.
okay. So next slide. Okay, the last slide. Okay, so these are the answers for the question. Okay, I think that's all for us today.
Okay, thank you. So this is an important lesson to us before we speak about fever and rash. But now your colleague who is Hanan and Hayati, let us go for another issue. Now we are speaking fever and CNS signs, which may be increased intracerebral pressure, bulging. So I am going now to meningitis encephalitis. It may be with time Fadil can present to us a patient with pyelonephritis fever, and now we have pinching of the kidney, we have UTI. So remember that there is two spaces in our body, urinary bladder and the CSF, one from front and one from the back. Usually we need a specific test for them to diagnose. You cannot completely diagnose the UTI or CSF until you are able to do the test for them. So please take care about this one. It is very important. Sorry, just a while. Okay, so we're still working with the same one, fever, and now came neurological, can be convulsion, can be before convulsion, like that. So this is now working our mind. It can be pyelonephritis, sometimes also otitis media in children can cause fever and pain and like that. So remember these three: meningitis, pyelonephritis, and otitis media during considering fever in children. My message is clear for you?
Yes.
My advice must be practiced every day. Every day, add even extra page, extra reading in medicine for your future. That is an important habit for the one who need to be pioneer. You need to be not just a normal doctor. He is the one who need more intention to make ibadah for Allah through his career. It's not just I would like to be a doctor, to be famous, to be rich, to be. No, we have, as a Muslim, we have more amani from Allah, more ambition from Allah. Okay, so please start good and save every minute and every time in your life to apply the ayah وَقُلْ رَبِّ زِدْنِي عِلْمًا. You know the ayah وَقُلْ رَبِّ زِدْنِي عِلْمًا. Okay, now do you need to ask me any question? Okay, so your marking today will be for Ayman 7, for Hanan 7.5. Okay, and your job are very good as a starting. Hoping inshallah see you with the best progress. The next time for presentation, I prefer to make the, do you know what is the single blind, double blind, triple blind in research? And the next time I prefer for the one who is going to be examined like Ayman or Hayati to be blind. You didn't inform them about the case. They will see it. So when he is asked about the history, is plano. You must come and like any scenario. I'm coming now and I meet the patient, the mother or father, and trying to collect the history and let my brain work. Okay, so please, with the next time, even you can tell the group the examined doctor must be blind about the diagnosis. Okay, and thank you very much for the assessing group with him for nice presentation and nice slides. Please complete it and send it to me after that. Okay. Thank you and see you soon, inshallah, in the world to be life education.
Thank you, Doctor.
Okay.
Thank you, Doctor.
Are
Thank you,
welcome.
Doctor.
Pray for me and see you, inshallah.
Ya Doctor.
Inshallah.
Assalamu alaikum wa rahmatullah.
Waalaikumsalam.
Waalaikumsalam.